Reactive training systems.
One of the things that I hear from a lot of that, from a coaching perspective, I'm not a doctor of physical therapy perspective, is emerging strategies. You
Yes.
are assessing the lifter and you are emerging your strategy to fit the way that they are presenting to you. And it's not
Yes.
a standard, oh, we're going to do these 3 exercises for everybody.
Yes.
See, that's one of the things that I really enjoy, because the other thing that I kind of heard from that, try not to go down a long rabbit hole, is in the world of physical therapy, you're likely to get a lot of different types of physical therapists with different strategies, right? Because you mentioned chiropractic, and my partner Vanessa is a chiropractor, and that's one of the things I've seen and observed in the chiropractic field is there's a lot of different techniques, and they're not all the same, and they don't all do the same thing. And one of the things that I love about the cross thread here between what you do and what she does and what we do is emerging strategies. She does the same thing. I don't get adjusted by her the same way every time. It is what she's doing is based on what is presenting in that moment. The strategy is emerged based on the emergent information in that specific moment.
But she has a system in place to pick up on emergent information that gives her information as to how she wants to treat you going forward.
Yes.
You don't have the patient get the same 3 sets of manipulations, get off the table, and you send them on their way, and they come back a day later and get another manipulation done. You ask them, did that have an effect on the thing we care about? We call that an objective or functional asterisk in physical therapy. Did it make better what we care about? And sometimes we can be a little more precise with that. We can have leading indicators that maybe this is the right track based on clinical experience. Oh, I saw this range of motion improve, and I know even if we can't test the thing that matters to the lifter right now, if we go on this track, there's a good chance that other thing will change too. But again, it's based on you have to have a system in place to pick up on those details, or otherwise you're just throwing stuff at a wall and seeing what sticks.
Right. Which, I mean, that's one of the biggest things that I like to hear, when I come into conversations like this, is that there's a bit of a system in determination of which path should we go, rather than just trying to do all of them at the same time. Because I think that, especially in the sport world, we see that a lot of times in sports care and therapy is people will go and they'll get a massage, they'll get dry needling, they'll get chiropractic, they'll get PT, and they just throw every single thing at it, and then they'll get better. Well, what worked? What was the thing? Or like you can get that same thing and just waters down the whole system, and it makes it difficult.
The other thing that I would say to that too, Ross, is there's a time course of injury as well and recovery. And sometimes it begs the question, was this going to get better anyway?
Yep.
Was this going to get better with no intervention, right? Like we see that with like sham treatments and the sham research, right? And so what I think, like when I hear this, Nathan, is you have a system of going down a path of what could, in theory, make this injury better for that individual in terms of pain management. But your litmus test is, can this athlete do the thing that is most important to them? Can they do their sport? And are we moving closer in that direction to them being able to do their sport? Which is what I experienced with my treatment with you. So I've seen physical therapists, which would be very workload management focused. And that seemed intuitive to me. That seemed like we ought to do that anyway. The piece that seemed different to me was the litmus test am I able to get under a bar?
Yes.
Am I able to get under a bar? Am I able to perform this? And yes, we need to address workload management. We need to be thinking about repeated exposure, spinal compression and shear. We need to be thinking about those things. We need to be thinking about, proximity to the last training session, loads that were used. You talked about like RTS and going down the rabbit hole. central stress, peripheral stress, thinking about those things. We need to think about that. But the litmus test is, can I get under the bar and can I have progression back to what I would consider to be sport form?
Hey, let me tell you something that I know about you. Your lifting is important to you. It's probably one of your biggest priorities. And for people like us, nothing compares to the feeling that you get when you set a new PR. That feeling of being the best that you've ever been, of doing something that you've never done before. This is what we're all after, and it's also what RTS specializes in. Getting you the absolute best program possible so that you can hit new PRs and reach your goals. We call it radically individualized training, and we're really good at it. Whether we need to account for busy schedules or equipment limitations, or precisely turn the dials and get the details of the program just right, we have the tools and the experience to guide your lifting to the next level. To us, coaching is all about leadership, relationship, and creative problem solving. A coach should be poised to help you make tough decisions about training and competing so that you can continually grow in your development. And of course, a coach should be a first-rate problem solver, especially when it comes to your training, technique, and strategy. Now, all this has to be built off of a really strong, professional coaching relationship that emphasizes trust and respect. Additionally, RTS coaches are not on an island. We have a strong network of professionals to reach out to, so if you find yourself in need of some specific expertise, say in the realm of nutrition or injury management or sports psychology, there's a deep expertise available there too. For more information, go to store.reactivetrainingsystems.com and click on coaching. That's store.reactivetrainingsystems.com, then click on coaching. Hope to see you on the team soon.